Okay, now we're doing part 2 of Prevent and Reverse Kidney Disease by me, Pete Rogers. We briefly, talked about the causes of chronic kidney disease, CKD. You want to know this because the good news is most of this stuff, if you catch it early, it's reversible. Even if you catch it moderately late or late, you can still benefit it a lot. Because the cause of hypertension and diabetes is high-fat, high-sodium diets and processed food. So stop eating high-fat, high-protein, and high sodium and oil diets, okay? And you can make things a lot better. You also got to watch out for toxins in food. I don't eat any powdered foods because powdered foods very often contain heavy metals. All those protein powders, they're very routinely contaminated with heavy metals. There's a Consumer Reports article. I put the links to it right below about how common that is. Also, if you got dental amalgams, the mercury in dental amalgams can contribute to worsening kidney failure. You could consider having those taken out. Okay, and then we're gonna start getting into some of the other things that you could do. The key is you be proactive and do everything you do. Remember that, Walter Kempner was having tremendous results with these kidney patients. Okay. Also, maybe you have kidney failure due to an autoimmune disease, or an autoimmune disease is contributing to it. It could be a big autoimmune disease like lupus. It could also be just you have amyloid clotting because you have leaky gut, and that's plugging up arteries in your kidney. So you want to get plenty of dietary fiber to prevent you from having leaky gut. Let's see. Yeah, so, the way you protect your mouth from cavities, so you don't end up with dental amalgams or root canals, is you avoid the sweets, you avoid the acidic foods like soda pop. Soda pop's not only acidic, it's also sweet, it's also sticky, sticks to your teeth. Avoid orange juice, it's very acidic, it'll burn holes in your teeth. By avoiding atherosclerosis risk factors, you maintain good blood flow into your teeth, so that creates hydrostatic pressure to push fluid outward from the center of the tooth outward through the dentine tubules, and that helps prevent cavities as well. Your saliva goes down at night, so make sure you floss before you go to bed at night. I currently just brush with an empty brush. I don't use any toothpaste. There's so many toxic chemicals in toothpaste. You're just trying to get some of the plaque off the tooth to prevent the biofilms from becoming too bulky and leading to plaque. Let's see what else. Watch out for medications that decrease your saliva because those will predispose you to developing cavities. The main thing the kidney does, so the question is, what's the main thing the kidney does? Our next one of our FAQs. Also, some medications can have kidney failure effects. Watch out for non-steroidal anti-inflammatory drugs, aminoglycoside, antibiotics, and a lot of other drugs. I should have made a list of things that are bad for kidney function. Okay, what is the main thing the kidney does? Their main job is to excrete nitrogen. It's about 75% of what they do. So you minimize dietary protein. You give your kidneys a big vacation, give them a chance to heal, and at least don't accelerate their worsening. You prevent them from going into what's called hyperfiltration. Especially animal protein pushes the kidneys into hyperfiltration, which is like making them work a triple shift. Okay, why should I care about the kidney excreting nitrogen? Because most people eat way too much protein, way too much. Like double, triple, quadruple, 4 times, 5 times what they should. Okay, so you cut down on that, you give your kidneys a vacation. All right, what are the units of glomerular filtration rate? Milliliters per minute per meter squared, okay? We just say the number, we never talk about the unit. What's a normal blood albumin level, the blood protein, most important blood protein? Albumin, it's usually 3.5 to 5.5, and you want to keep your albumin above 4. Above 5, 4.5 is ideal, and that's a big deal because basically if you're keeping your albumin level high, normal high, then you're doing good. Worsening kidney failure usually leads to more leakage of albumin into the urine, and that's a sign of losing the fight, so to speak, against kidney failure. So what is albumin? Albumin is a plasma protein in the blood. It's made in the liver. It's about 50% of all the blood proteins, so it's the most common blood protein. It has a molecular weight of about 60 kilodaltons, so it's a reasonable size, but it can still get through the glomerular filtration system a little bit. Normally then it gets reabsorbed into the blood, and most of it shouldn't go through. So normally a small amount of albumin is filtered through the glomerulus, but it is mostly reabsorbed. By the way, it has a half-life in the blood of 20 days. In patients with proteinuria, too much albumin is getting into the urine. Albumin does have a negative charge on its surface called a zeta potential, just like red blood cells and white blood cells and the glycocalyx of the endothelium. They all have a negative charge on their outer surface called a zeta potential, which is good, so they don't stick together. Albumin helps maintain intravascular oncotic pressure, the osmotic pressure that attracts fluid back into the blood vessel at the venous side of the capillary, so it doesn't just leak out into the third space, into the extracellular space around your tissues. Low albumin means albumin less than 3.5. And that's bad because when your albumin gets that low, you can get third spacing, meaning fluid leaking out of your arteries at the capillary into the soft tissues and not being able to get back into the capillary because there's not enough osmotic pull. What is microalbuminuria? It's when you have 30 milligrams in the range of 30 milligrams in your urine over a 24-hour collection of your urine. So that's a little bit of protein going in your urine. Macroalbuminuria is greater than 300 milligrams in 24 hours. Nephrotic syndrome is when you got greater than 3 grams. So these are basically analogous to orders of magnitude, 10 times more, 10 times more. Normal blood creatinine is like less than 1.2, 1.18, but you can just call it 1.2. Creatinine is a waste product from muscle tissue breakdown and a molecule called creatine. Normal muscle cells have some turnover and die and are replaced. When a muscle cell dies, creatinine is released into the blood. In kidney failure, creatinine goes up. Creatine supplements can cause it to go up. Eating meat can cause it to go up. Lifting heavy weights can cause it to bump up a little bit. The main thing that bumps it up, though, is kidney failure. Okay, what is normal blood urea nitrogen? So we're going through the basic labs that are checking all the kidney failure patients. BUN is what we usually call it, blood urea nitrogen. It's the ability of the kidney to clear the nitrogen from the blood. The liver puts nitrogen in a molecule called urea. Then the urea is excreted by the kidney. So the urea does that to detoxify a lot of toxic things. Makes them a little more soluble. They can travel through the blood and be excreted by the kidney. Sometimes it just pushes them into the bile. They're excreted into the bile. Then when you defecate, you get them out of your body. Normal serum ferritin is about 26 to 388, but ideal serum ferritin is more like around 30 to 80. Okay. And I don't donate blood formally, but when I get a blood lab, I have them pull off a couple tubes and discard it because that I want my serum ferritin to be lower because you don't want free iron floating around in your blood. It can ferrous redox cycle, and that increases the thrombogenicity, the likelihood of blood to clot, and it causes other problems too, oxidative stress. What is RRT? RRT is renal replacement therapy. So first of all, there's hemodialysis. Most commonly, it starts off with a catheter in the neck, a tunnel jugular dialysis catheter. I placed a couple thousand of those. You can also then make a fistula in the arm or place a graft, a prosthetic graft in the arm. Usually they'll try to make a fistula near the wrist initially, then they'll move to the upper forearm, then they'll move to the upper arm, and each one progressively tends to thrombose, and then you run out of doing it. You start on the left side because most patients are right-handed, then you go to the right side. I used to do declots on those things, all that stuff. Peritoneal dialysis can be done at home for many patients, and the fluid is in the peritoneal cavity of the abdomen. And then what patients want is a kidney transplant. But even a kidney transplant, it's better than being on dialysis, but it's still not great. They have to take a lot of immunosuppressive drugs. The kidney transplant surgery has a lot of complications. It's not a walk in the park. And the immunosuppressants, put them at risk for other things. So sometimes you got to go down that path, but the best thing to do is everything possible to prevent it. Okay, now which patients are the stupidest? And this is kind of sad, but in my over 30 years of being a doctor, I say the stupidest patients I meet on a regular basis are dialysis patients. And it's kind of sad because the dialysis makes their blood very thick, very prothrombotic, so they tend to be mentally very slow. They're real high risk for cognitive decline, even worse. And, like I said, half of them are dead within 5 years on dialysis. So it's bad. It's like, having an aggressive cancer. Now, there's some really smart dialysis patients that really control their diet. And in a sense, they do half the work of the dialysis machine by controlling their diet. And those are the ones that are likely to live the longest and still be pretty highly functional. But most of them just don't have the energy, the reserve, the thought process, the reading ability to do that. Most dialysis patients are just sad and pathetic, okay? Low-fat, vegan, whole food, organic only diet and exercise, that helps to maintain cognitive function. Okay? All right, next thing we'll talk about is what is a kidney failure heat map? So a heat map just means that you can combine the GFR and the amount of protein in the urine, albumin in the urine, to predict the risk. So the bottom line is the worse the albumin in the urine, the higher the risk ending up on dialysis. So the green means very low risk to progress. Okay, so if you're over 60 in your GFR and you don't have any albumin in your urine, you might do quite well and live the rest of your life and keep your kidneys. But the worse that GFR starts dropping below 60, and let's say you've got protein in the urine, your kidneys are failing rapidly and you're headed towards the dialysis machine. So you want to get your act together as fast as you possibly can. And paradoxically, reducing dietary protein will tend to reduce the amount of protein going in the urine. And paradoxically, that'll elevate your serum albumin typically. Okay, but this is called a heat map because the red, implies hot, and the more protein in the urine, albuminuria you got, from microalbuminuria to macroalbuminuria to proteinuria and nephrotic syndrome, the more likely you're going to be in full-blown irreversible kidney failure, end up on dialysis for the rest of your life, which will probably be short. So the good news of all this is there's a lot you could do, and we're getting to that, but I'm just trying to get you to understand first. So that's called the heat map. Okay. Let's see. What else does the kidney do? Well, actually, here's a quote from Dr. John McDougall. He says, "Our goal with these kidney failure patients is to protect them from protein poisoning. Fruits are fine with mild kidney failure. However, with severe kidney failure, I prefer to feed them grains because they're lower in potassium. It's okay to add sugar because there's no nitrogen, potassium, sodium, or phosphorus in sugar." That's like what Kempner did. Okay, but that was kind of a key point. The grains have a lot less potassium than the fruits do. For the people who have to worry about that, that's usually with relatively severe kidney failure. The mild kidney failure, they're just fine with their potassium. So anyways, we'll leave it at that for today. Hope you found that helpful.